Medical Officer for Health Security, Preparedness, and Response in the Oregon Public Health Division at Oregon Health Authority. And I'm here in case you have specific questions about health effects of these toxins.
Have you been monitoring the data any more closely than your counterpart? Can you say whether it's going up or down?
So again, I'm here to speak mainly about health effects, and unfortunately, I do not have the data memorized.
Could you describe what the possible health effects are? When I was on the EPA and CDC websites, they said it's really not known totally what the health effects of exposure to these type of algae and toxins are.
Well, we have a pretty good understanding of the two toxins that have actually been detected. And one of these is known potentially at higher levels than we've seen, potentially to cause problems with injury to the liver. Actually, both of these two toxins that have been detected can potentially cause injury to the liver, and that's one reason that people with known chronic liver disease are considered to be at increased risk for problems. One of these medications one of these toxins can potentially cause injury to the kidneys. And again, that would be primarily an issue for people who have underlying chronic kidney disease. What we see more commonly with these toxins is irritation of the stomach and of the intestines, and that can result in vomiting, in nausea, and in diarrhea. Typically, those are symptoms that would be more common at exposures higher than what have been measured so far. And I think it's worth noting, just to put this in perspective, I think when EPA chooses a threshold, they choose a threshold with a lot of padding built in. And so when they say that there is a level at which we begin to have more concern about possible exposures, we don't think everybody who's exposed to that level is going to have a problem. That is people who are particularly sensitive, who might have problems at that level. So we've got some padding built in, as it were. Does that answer your question?
So I know obviously from like ingesting the water, if you're under the age of 6 or have immune system that's low or whatnot, it's obviously bad. But like coming into contact with, say, a cup that was washed in that water, I mean,
pretty unlikely, actually. And it is more of an issue of ingestion, unless you happen to be say a dog that is going and swimming in Detroit Reservoir and chomping a bunch of cyanobacteria. That would be a higher risk thing, but then that's ingestion too. So ingestion is the main risk here.